Hello, everyone, and welcome back to yet another episode of Sehat Beyond the Clinic. I'm your host today, Dr. Rutresh Rao, and today we are going to feature one of the most prominent topics that are actually rising around in the social media, conventional media as well. So we're going to talk about violence against women and children. And today we have a very, very, very interesting guest speaker. One of the prominent voices, or one of the earliest voices that actually spoke about violence against women and children. We have Dr. ALWI here today with us. Thank you so much for making time for us today, Dato. Thank you so much for also, spending a little bit time to speak about this topic, which is also your specialty here today. So, Dato, why don't you tell a little bit of yourself, about your experience, and how do you associate yourself with this particular topic today?
Great. Thank you, Dr. Rudra. Thank you for inviting me. I think this topic that you asked me to discuss with you is, I think, an excellent topic, very relevant, and it affects globally all women, child, as well as intimate partners globally. I think let me introduce myself. I am Dr. Mohamed ALWI, and I'm an emergency physician training. My subspecialty is prehospital care and disaster management. And of course, some of my research are related to violence against women and children. And in 1998, when I was in Kuala Lumpur Hospital, I produced my thesis on pattern of violence against women and children. And that even in 1998 itself is a hot topic. And that is in pursuance to the existence of one-stop crisis center, which was established in Kuala Lumpur Hospital Emergency Department, which is a pioneer in Malaysia, which was led by our former head of the service, Dr. Sri Abu Hassan Shari. And of course, follow up by our current DG, Dr. Mahata. And subsequently, the numbers of emergency physicians that was in charge to evolve, to develop, as well as to promote part of the public health preventive, I will call it as disease, which is the violence against women and children. And as you can see, in 2026, things has changed and things has become more robust, more critical, more dangerous, and is having an impact towards the community's wellness and mental health care. So I think this is a great topic, and I'm very happy to discuss and explore.
Yeah. Thank you so much, Dato, for actually giving a slight introduction about yourself. I think you've done excellent work previously. So I've also had the privilege of working along with Dato earlier, because I was also part of the Crisis Preparedness and Response Center, in which I was the Interim Assistant Director for National CPRC, and then I had the privilege working across for disaster management, which I believe is one of the most underrated areas. People seldom look, I think they overlook this department, because, we are always a country not under attack, not under disaster, but actually disasters not only come from external, but one of the disasters that are underseen or, overlooked is also violence within the country, within our own community ourselves. So, to start off, Dato, how common is violence against women and children? And do you think we are actually underestimating this particular area, Dato?
Okay, as I said earlier, violence has become very open now, especially towards the gender age group, which is the young and old. In fact, there is the gender inequality has become a greater issue now, and violence against a woman who is also a mother, who also a leader, who is also a professional or non-professional, affects the family institutions. And if you see from 1998, which I started about 274 cases in 1998 to 2001, there's only about 270 to 300 cases. But now if you look at the current data, it is almost touching about 7,000 cases, which is reported. The unreported is unknown, urban and rural. So it is also depends on the woman's willingness to report such a case to the authority or to seek help at the NGOs, which we have a lot of champions of NGOs, especially WHO or AWAM, and they are pioneer. Of course, Jabatan Kementerian Keluarga dan Masyarakat is very actively involved. So you can see the data according to WHO is 1 to 3. According to Malaysian, the study done by PPUMC, it is 1 to 7. 7, yeah. So violence against women is not necessarily physical. It also can be in a different form. It is mentally abuse, or economically abuse, or deprivations, or sexual abuse. So it is also even body shaming as another issue that I think we put into thoughts, how violence can perpetuate cross generation. So I think our society, which is a very traditional, conventional Asian values, which we respect of family institution, the leadership of our man, the husband. We normally try to keep it quiet within the family, and you don't want to be stigmatized by the family members as well as the neighbors as well as friends. So there's a lot of issues and violence of women that is not reported. It is having a direct cross impact towards economic development. Also the productivity of women in industrial world, particularly in Malaysia, and of course family institution, the strength of bringing up children, which is looking at our way of life that they're going to be following in future, and they're going to apply it to their own family or their own society in future. So it's all a cause and effect between the woman that has been exposed to so much violence unreported, and then it is in cross generation moved to current generations, and with the existing of technology, cyber war, machine learning, we are losing the ethics and core values about humanity itself. So it's time that we create awareness. So violence, as I said, it's a time bomb. It is already exploding by multiple level and dimension. And society have a role, community have a role, leaders have a role to find a ways and create recommendations so that we cannot abolish, but we can certainly do collateral damage, reduce the impact, as well as do some early recovery.
Understand. Dato', so now spanning back to this topic again. So in your experience, that I'm very sure you have seen thousands and thousands of cases. Why do you think it's the primary cause or primary reason some of the survivors of this violence actually hesitate to come forward to ask help? What do you think is actually stopping them, or what do you think is holding them back from coming and seeking help or even reporting it?
Excellent question. Thank you very much. I think it is all about how we have been brought up in our family. See, during childhood days, when we are parents, we teach our children to stay quiet, to remain calm, to ask questions. And then there's a lot of negligence. If you look at in the 90s and now, there's a lot of negligence because of the demand of bringing the best economy towards the family to earn more money and everything. So there's a lot of first part is the negligence from parenthood. Parents oversight about looking at the children. That is one. So there's no continuous monitoring how a child, whether it be boy or girl, we don't monitor them well. We look at school bullying, another concept, bullying in terms of sexual bullying, physical, mental bullying. Bullying is also can be translated into an abuse, violence against children, violence against women. Violence can be in many forms. So that is one component. Second component is the economy, socio-economy, the ecosystem where they are, urban area as well as rural area. So there is a level of increased negligence or responsibilities that is from the man to the family that is being gap. There's a lot of gap on that, and influenced by other habits like drugs, alcohols, and crimes and all that. That exaggerate the kind of violence against women. Now, the third is, of course, the demographic and education's literacy rate. Thank God, Malaysia, we have a good, very good literacy rate. That's for almost 98% to 99%. Everybody can read, write, and everything. So, but again, having said that, the focus on bringing in awareness towards the community to report, with the current world, even neighbors don't know each other.
Yeah. I think that's one of the biggest problems, right? We live in a neighborhood. We don't even recognize, we don't even speak to people. So people tend to just say, okay, I don't know what's happening there. Probably it's just another day for them. Just walk past by.
Yeah, because they thought it's just part of the family affair.
Yeah.
It is part of family affair because the early warning signs is the early warning symptoms are quarreling, fighting, economic causes, abuse, negligence, as well as, of course, as the man itself can have multiple relationships, as well as absenteeisms from his side, as well as all these cause absenteeisms of the woman to the work, to the schools, to the universities. Again, extramarital affairs, there's another issue also, So all these triggers and the prejudice, the man is mighty, a man is always right. Man is a better leader than a woman, and all this brings about a man who become instead of a hero, he become a criminal, he become a zero. So this thing, there's no champion. So in our house, there has to be a champion, somebody who can model and give directive, and then put the whole family into a good ecosystem so that everybody grows well. This can have an impact on the long term towards not only to social economy as well as to the healthcare providers, the hospitals, the emergency departments, as well as counselors and etc. So early intervention is the best strategy.
And that's right. I think one of the important things that you just mentioned also about the healthcare practitioners, Datuk. I think in my own opinion as well, a lot of these survivors. So part of my experience as when I was doing pediatric medical officer right at that time, one of the things I always realize is that the first contact, when they realize, especially when it comes to child abuse, right, taking into the use case scenario of child abuse, many of the parents, they probably think that, someone has abused the child. It can be someone that they have, given the responsibility, can be grandparents, can be the neighbors, can be the nannies as well, the babysitters and all. There's a very often story that we're hearing right now in Malaysia that, they actually abuse the child, or even the maid, right? Even the maid in the house who's actually abusing the child. So how important is actually the first interaction between the healthcare workers and survivors? Because I feel, we as the healthcare workers, how should our first interaction be? So what would be your advice to the healthcare workers in this point, Datuk? Now, how should be the first interaction? And then from there, how should we actually take a step to identify that, yes, this is actually an abuse or a violence that is actually being, we come up with a lot of diagnosis, right? So how do we actually work towards the diagnosis of abuse? Patrick?
Well, we saw in the 90s as well as the 80s, but 90s is a time where we saw that the victims, they are being exposed in many ways, either through media. In media comes in only when in extreme cases like burn, like they had a massive trauma, so which later investigated to be the root cause of domestic violence, which is missed because of frequent visits to hospital. So in the 90s, I think I must say the Ministry of Health, with the leadership from emergency department, led by Datuk Abu Hassan and our team, which include me, the core teams. We thought that we have to bring about change in early detection, early prevention, and do a damage control, as well as create awareness through healthcare providers. Healthcare providers can be anybody, from the hospitals to clinic kesihatan to the GPs. or even private hospitals. So then we always go back to the Domestic Act Violence, which is 1994, which subsequently, in 2005 has been updated. And this law has been used as a tool by the hospitals, and using the template of one-stop crisis center, which was a template of Canadian system.
Right.
We are among the pioneers in Southeast Asia and Asia. I can say that we took up this concept as a comprehensive healthcare.
Right.
A comprehensive healthcare under one-stop management of violence against women, domestic violence, or battered women, or intimate violence, and also suspected child abuse and neglect campaign. And we use multi level agencies. There is both police as well as counseling, social workers, as well as the different agencies, different departments within the multidisciplinary departments like the hospital, like ONG, forensics, and all the other departments, psychiatric departments. We have come up with SOPs, guidelines, and training modules to do and train all the personnel at the emergency department, which is the most busiest department in the world.
Yeah.
And more so now with the current shortage of resources, infrastructure, etc. Again, we are looking at people coming with medical emergencies and communicable disease, trauma, and etc. But again, we are missing this. Even though they are well, they are feeling good, but they are physically, emotionally, they are with abuse. So they come at the first step is at the emergency department, green triage. So the one-stop crisis center has changed the whole scope of our service, where we put direct priorities, where our triage officer at the emergency department look, see, detect, triage. The triage is still the same, green, yellow, and red, according to the severity of the illness or the trauma caused on the woman or child. And from there, for those walk-in 24 hours, it's a 24-hour service of walk-in, they are put directly to a one-stop crisis center room, which is far away from within the emergency department, so that to secure the safety and security of the client, of the patients from the perpetrator. And it is being attended by a dedicated team, and of course, a multidisciplinary approach is there to rule out is it a physical violence, or is it sexual violence, or child abuse, neglect, or is there any other cases like sodomy, and etc. So it is a very comprehensive, one touch, one stop, as well as rapid speed and scale. We are preventing a secondary trauma towards the patient. The first trauma is already from the home or from the work site. So this is how one-stop crisis center now everywhere. I think more than 144 hospitals. I must say congratulations to the emergency staff, as well as the public health, as well as the Ministry of Health, for prioritizing anything. Yeah, prioritizing, working along with the Kementerian Keluarga dan Community, and also Jabatan Kebajikan, as well as the Psychiatric Department. We are closing the loop, but more so now we need to increase and double the effort, because the current pressure, the current stress, the both urban, rural people are going through, especially now with the current trend of an increase in economic costs, loss of job, unemployment. All this is contributing factors towards violence. So if we can control all these external factors within the family, outside the family, and improvise the ecosystem, which can have a better approach, faster approach, and heal them as early as possible, I think we can stop the propagations from current generation to the future generation through early intervention.
Very true. I think one of the very, very important things that you have highlighted is the very existence of an OACC. So OACC stands for One Stop Crisis Center. A lot of Malaysians out there do not know the existence of such service. So if let's say you are actually a victim of violence, right, or we are a victim of any sorts of abuse, can be sexual, mental, any type of abuse, you actually have this particular service available in all hospitals, all major hospitals across the country. in which you can go into the emergency department and you can actually seek assistance and shelter as well at the same time. So this one-stop crisis center gives you a service of where there's an emergency physician or an emergency medical officer attending to you and triaging you and assessing you, making sure that, okay, they identify you as someone who's a survivor of violence, and immediately you actually have multidisciplinary approach where we actually have the police officers, we actually have the counselors, we also let's say, identifying the crisis accordingly. Let's say a requirement of an obstetric and gynecology medical officer to be there, they will actually be present. A pediatrician to be there, they'll be present as well. And if, let's say, a social worker needs to be there, they usually call this as pegawai pelindung, pegawai pelindung in JKM, which is actually a protection officer from JKM will also be assigned to this person. And until the threat of this particular child or this particular woman is actually eliminated, this person can actually seek shelter in hospital. This is actually something that is not publicly, sometimes probably this is not publicly available, hence why we actually choose the topic today. And actually it's excellent that Dato was actually in the very early stages of implementing this particular system in a hospital. So thank you so much once again, Dato, for that. And moving on to our next question is that from actually your observation, how can childhood violence actually affect people later in life? That means if, let's say, for example, we're now not only talking about the child who's actually receiving the violence, but the child who's actually observing violence as well. It can be the violence in between the parents, or it can be they themselves being the victim of violence, right? What would actually affect this child, and how this child will actually, reflect upon it as an adult in future? What is your opinion on this, Dato?
Okay. I think one of the promises of parenthood is to give the best for our children, including education, nutrition, wellness, and support, including moral support, as well as put them to become relevant and useful to the society. And also, now, every disease starts from home, as I can say, let it be infectious disease or non-infectious disease, in a big group, in a smaller group. But if a child witnessing violence, between mother and father, or between brothers and sisters, violence which is due to external factors like debts and everything, and all that can be crystallized into the growing mind of a child. And we know that from from 2 years, as early as 2 years to 7 to 11 years, these children, they need a good environment and ecosystems to harmonize their life and to get love as much as possible, and then to become a useful person. Now, if they see this violence, like a violent parent or a alcohol parent or drug addict parents, or if they witness quarrels, if they witness abuse to anyone,
and these parents tend to normalize it. They tend to normalize their habit. They tend to normalize their toxicity behavior to the children as well.
Yes, and that caused deprivation, and attention was not given to the child, and the child is neglected, and no supervision on the child, and there is no proper day-to-day support for them. They are lost, and they're lost as time goes. If they grow up, they tend to repeat this thing to others because they accept it as a norm in a family to grow up. So they can go choose a life which is more of that pattern of modeling or violent modeling, or if the early intervention is there given by the schools or by the authorities or by the NGOs, if they come to know these things taking place, this can put a stop, can stop the clock of violence. So now the issue here is, if a child witness all this, he is associated towards this kind of nature, and he will assume it is normal, then once he get married, and he will do the same thing again. So education and awareness is very important to make sure that can be prevented. And child must be a disturbed child, either a disabled child or a child that is suffering from autism, more so, and violence. these are secondary impacts, violence they see, and then their autism and everything. So, and not given proper healthcare to the
It will
children.
affect their growth as well.
Everything from nutrition and growth to mental health care, and they become, and we have seen this during COVID-19. COVID-19, where there is less of social interaction, social deprivation,
Especially those COVID
excessive-
babies. We call them COVID babies.
Yeah.
COVID babies, when they came out, they're so afraid of people. When we thought they actually have stranger anxiety, it's actually because they've been in the house for 1 year, 2 years, and then when we bring them out of the house, they feel very anxious. They feel that this is something new to them. They always thought the house is between the walls only, but then the world has actually moved away. Those kind of concept. Yeah,
Right. And then also now they can get advice from Google's, from Facebook, and everything, from peers, which they themselves are not the right people to
yeah.
to
seek advice.
and to seek
Yeah.
advice. So they have a alternative way of getting information, and the information can be abused. And then they go to a cyber world, technology, and then they divert into what is happening in going to the porn side or gambling sites and all that. And then the children are very fast. They learn very fast in technology. When I go standard 1, they already have accessibility and their communications has improved. This communication become bad now because they are not communicating to teachers with their parents, but their communication with technology, the world in their own. And you can get free handphone.
They only communicating through these devices and all that.
So we got wrong teachers when parents don't take the first step in taking full command and control about the children of their kids.
Yeah. Also, Dato, now let's now move across the paradigm right now. That means now we're talking about what's happening in the family. We're talking about abuse from a husband to a wife, abuse from parents to children. Now, since our topic is spanning around violence against women, right? So let's shift a bit to adulthood life, right? So what do you think is, in your experience, have you ever experienced women coming and complaining about the abuse that they are actually experiencing through their work environment? So this is also something that's very common right now. Women tend to be abused mentally, tend to be abused physically as well at their workplace because of some toxic bosses. What is your opinion on that, Dato? And does it actually happen? And do you actually see these cases in hospital?
Yeah. Well, I think human relationship is very subjective, based on performance and perception, right? True. Yeah. So again, how to measure? Is there a right yardstick to measure? We have take any institution or even KKM, they have a yardstick of measuring one's success and contributions. Now again, we have an objective and targets in life, in the family as well as in the working place. How we cope, what's the coping mechanism that we have in running a family, the demand and supply, as well running working for the institution, which is our future and career pathway. Now, we need to balance it. Now, how many of us in real world, in the urban area, that we have the competency or the kind of training and we can accept that the existing external forces, like even a simple traffic jam, delay in taking a child to the school, leaving a child in a car because of their work existing stress, and that has caused children's death. That's very common in Malaysia.
Yeah. A couple of weeks ago, so we had in the news.
So it is all one of the existing co-factors. Now we have to go back into what we want in life. How we want communications within the family members, the husband and wife, the children. I think we need to have open communication. But if you put 6 people of a family in a table, nobody is talking. Now, when you don't talk, we don't get information. So this communication becomes, difficult. How do you want to get the information and measure? So, and the same goes to working environment. Working environment, we don't see eye to eye with our correct colleagues, and there is no counselor. But of course, in Malaysia, in government officers, we have registered counselors we are declared that whoever needs,
And we encourage our staff to go and, meet the counselors, take a break and all that. Yeah.
as compared to the Western culture, as early as young, they go and see a psychiatrist.
Yeah.
They go and
Therapist,
see a counselor.
therapist lah.
Therapist.
Yeah.
But here in Malaysia, if you go and see a psychiatrist, they will see your man.
Yeah.
If you go and see a counselor, they say you're
They might say you're not mentally well.
So it's very stigmatized. So we should take away this fear mindset from our mind. Go connect to your religion, whichever religion you are, having a faith on, go ahead. If it's a Muslim, then Imam, ustads and counselors, and if you are non-Muslim, then you have your own way approach and talk to your NGOs and everything. So there are 100 ways we are looking at how to solve problems at the office as well as the house and family. Bonding is very important. The first step. At the end of the day, it is always family that comes to you for the support system and to help you as compared to a stranger. But if you have conflicts and you have violence between your family members, then that is one side out. But again, there's not an end of the story. We always can go to a third party and etc. So one has to get the right advice. Talk to the boss. Prioritize what is best for you in your career. And of course, financial control has to be in place because the moment financial has been collapsed or fragmented, then the family will have a fragmented, life. So family very important. Get social support. Ask for help, just like our CPR. Now, CPR, you have to ask for help. Now in the one-stop crisis center or domestic violence, we have to shout for help. If it's a school, a university, you can see the paradigm of violence. The trend is moving upwards at all levels. Even among those disabled and handicapped. So even among geriatric age group. So violence is preventable. Early detection, early preventions, communications, get counselings, prioritize what you want in life, and then get a right person to advise you so that you get the right outcome.
Content. Yeah. So that has been one of the most enlightening session, Dato'. So as we are moving towards our final question today, to you, Dato', after decades being in emergency medicine, and also you have done a lot of humanitarian work as well. I think noticeably, one work that you have done is actually the field hospital set up in Bangladesh, and also our field hospital set up during COVID. I think these are one of those notable humanitarian work. And what changes would you like to see in society and healthcare system responding to violence against women and children? I think you've had a spectrum. I think from the 90s, things have changed, right? Like in terms of cases being reported, in terms of how we respond from the establishment of OSCC to the scan teams and all that. What would you like to see in the upcoming generation at your perspective, Dato'?
Okay. Whatever we can say, we can think, we can come up with guidelines or SOP where they think. But the one way to look is how communities intervenes and how communities support each other. Whichever other community. And Asian communities are very good because we are very mutual, very supportive, and very cordial. With all the races that we have here, as compared to the West. Yeah. The West, they have mental health problem because they don't talk. They don't want to talk. But in this year, it doesn't happen. And we have a lot of cultural festivals, right, which I see that opens the door for mix of people meeting the right people, etc. And again, agencies, government agencies, they have to prioritize and do promote and create awareness. Not all the government agencies in order to prevent domestic violence, child abuse, and also to intervene as early as possible and then guide them, counsel them. Now go back to universities and schools, everything. We have to look at preventive strategies, gender inequalities, as well as prejudice against men and women or children, other thing. So I think the ecosystem within the schools and universities, like alarm systems, early warning detections, the detection from the school teachers, the universities, professors. I think they have a great role. Last but not least is the role of communities, role of NGOs, which is they are the champion of preventing and reducing the impact of mortality and morbidity towards men, including men, women, and child. Even men, in my studies in 1998, even about 1% of the study, about 274 cases, even men got violence. But now the violence against men has increased tremendously. As you can see, I think about more than 10%.
Right.
So men hardly they go and complain. So again, it is not only women and child, it's also on men and those vulnerable group, the geriatric group, the negligence from parents towards the family member. Parents to their grandparents. That is one thing.
Children towards their parents,
children
their age as well.
So it is all about family integrations, family unity. Family has to be harmonized, live within the means, as well as ask for early help. And if need counselors and psychiatric support, go for it. And of course, it's always private and confidential. You see, OACC is private and confidential. It is not going to be exposed. It is not given unless the crime is so violent, some goes to a death or murder, then it's different. So it is a role of the government, role of the community, which is more than the government, and the role of the parents itself of bringing the future leaders for our country. And again, we must learn from other countries, which is much more deprived, resource poor environment nations like we know among Asians and African. I think we can learn from there, and our society we can move very fast. We are learned society. A society wants to transform, from prejudice to modernizations. I think we have to engage the right intellectual people, academicians, as well as the healthcare providers and the NGOs. Work towards more conference, more surveys, more research, and we have to look how to put a stop and stop the clock on violence and perpetration of violence by the perpetrator.
All right. Okay, so Dr. ALWI, thank you so much. Once again, I think these are incredible experience sharing session and insights that you have shared with us today. Conversations like this are very important for us because this is not just a private issue. This is actually a healthcare issue, a societal issue, and also more than that, a humanitarian issue as well. Before we actually end this session today, I would also like to reflect upon something because a lot of my friends who are not in the healthcare, they always say it's been a privilege to be a doctor. I would say yes, definitely. I think Dato would also reflect on this. Yes, it has been a privilege, but it is also a privilege for us doctors to be very empathetical. We have to be we have to treat our patients with utmost empathy. And at the same time, if these doctors are also given the power to be in a position or in an organization where they can be, chief medical officer, they can be managing director, they can be president. But when you are given that particular role, it's also your responsibility to treat your team, to treat your people as equals, and also to ensure that you do not, implicate violence on them. Because disrespect only invites disrespect, and violence incites violence. So I think with that, and to our listeners, I hope today's episode has been encouraging about awareness about violence. And so thank you so much for listening our episode today. And I would like to end this with stay compassionate with us and listen to Sehat Beyond the Clinic. Thank you so much, everyone.
Thank you. Bye-bye.